This was the completion of my first 120 hours for Preceptorship 1 at Towne Country Veterinary Hospital. So to talk a little bit about the facility, it is a small animal clinic. We typically care for cats and dogs, but we also do have doctors that specialize with exotics. So we saw things like birds and ducks and snakes and lizards, chinchillas and hedgehogs, just to name a few. So when you walk into the facility, you do walk right into the waiting and reception area as pictured below. The waiting area is typically where we have clients wait for what we call tech calls, which I'll get into later. But there is also this large desk. On one end is where you would be checked in, and on the other is where you would be discharged. This area is also where clients can do pickups for food orders and things like that we do through the facility, and also they can make purchases of things like Frontline and HeartGuard and other medications that they may need to purchase through the facility. To continue through the facility, we have 6 exam rooms, which is where clients would be sent if they are seeing a doctor. In these rooms, the doctors will typically do their PEs, visits for new puppies, and we also do euthanasias in this room if the clients opt to stay with the patient while they are being euthanized. Following through that back door of the exam rooms that was previously pictured, it will take you to our treatment area, and on the far wall is where we have all of our lab equipment. We use all IODEX lab equipment here, so all tests are computerized in a sense. This is where we would do blood work, urinalysis, fecals. All of our SNAP tests are also automatically done on these computers, and the results go right into the patient's file on a computer. The only thing that we have to look at physically would be urinalysis slides as well as fecal slides, as you can see on the microscope below. As you can see in the lower picture, we also have 4 exam tables in the treatment area. This is the primary place that the techs spend a lot of their time. This is where we perform all of our tech calls, which basically means that the patient does not need to see a doctor to have their services provided. So we take them right back into the treatment area and we perform things like ear cleanings, nail trimmings, vaccinations, and anal glands. We also do surgical patient prep in this area as well as dentals. Right off of our treatment area, we also have our imaging centers. So on the left-hand side is pictured the ultrasound room. This is where we do our cardiac ultrasounds, EKGs, bladder ultrasounds, uterine ultrasounds, and things like that. And on the lower right-hand side is our x-ray table. Also, right off of our treatment area would be our surgical suites, as pictured in the top left-hand corner. This is where all of our surgical procedures are done. We do amputations, laser spay and neuters, as well as suturing of lacerations in this room. And right off of the surgical suite is our pack and prep area. This is where we do all of our surgical packing, all of our autoclaving, and this would also be where the surgeon preps and washes for surgery. Towne Country does also offer boarding at their facility. So in the back of the hospital, there are a large number of dog runs where we would keep dogs that are boarding with us, as well as larger patients who have come out of surgery but are too large to fit in the kennels up front. The kennels up front are what's pictured in the top left corner. This is obviously where we keep the smaller post-op patients or those who do need constant monitoring. This is also where we keep our fluid therapy patients. In the far right corner is our cat kennels, which we also have. Those are right off of the treatment area as well. In our facility, we also have a pharmacy and stock area. In the pharmacy area, we do fill prescriptions for patients being discharged as well as those who need refills. We take all of our drug inventory here, and we also stock a variety of over-the-counter options that can be used for our patients. In the stock area, we typically keep treatment supplies, prescription pet foods, treats, and dietary supplements that can be purchased by clients of the facility. Now that we've finished discussing the facility, I'd like to move on to the staff. There are 5 doctors on staff at Towne Country. This includes Dr. Ann Carey, Dr. Mike Carey, and Dr. Colin Carey, who are a family, mother, father, and son, as well as Dr. Michelle Warren, Dr. Denise Hardisky, and Dr. Jessica Artero. While all doctors are well-rounded, each of them do have their fields of interest, which are listed under each of their names. While during my time at the facility, I only saw Dr. Ann Carey and Dr. Michelle Warren performing surgeries, all of the doctors do stay on staff and work throughout the week with clients and patients. There are also 4 licensed veterinary technicians at the facility. Rhoda Lewis and Crystal Knickerbocker are the head technicians. They are responsible for scheduling as well as dentals and monitoring of surgical patients while under anesthesia. The other techs, Michelle and Alex, are responsible for mostly tech calls. They would do things like blood draws, nail trimmings, ear cleanings, injections, and things like that. We also have 3 veterinary assistants, Marie, Casey, and Alyssa, who are in charge of restraining, cleaning, feeding, and things like that for patients that remain in the treatment area. Rounding out the facility, we also have 2 administrators who are in charge of management, order placement, hiring and firing of personnel, as well as 2 animal caretakers who feed, walk, board, and clean after all of our patients. We also have 10 receptionists who are in charge of intake and discharge, answering of the phones, scheduling appointments, and emailing clients. Now moving on to my position in the facility. I felt as though I was held to the standards of an assistant. I was mostly used to restrain or assist wherever and whenever needed. I was also expected to observe, inquire, and record what I had seen. I assisted in tech calls by bringing patients to the treatment area, talking to clients, and relaying information from the medical charts as they came back. Below is a list of things that I accomplished while at my preceptorship. These include things like monitoring fluid therapy, cleaning and medicating ears, pilling and medicating patients, x-raying patients, filling prescriptions, scheduling appointments, running blood work, fecals, and urinalysis, monitoring patients under anesthesia, placing ET tubes, and using sterile techniques while in surgery. Now moving on to the case studies. The first case study I chose was an emergency situation in which a smaller dog had been bit by the neighbor's Rottweiler. When this patient arrived, we found that she was an elderly Chihuahua mix, weighing approximately 12 pounds. When we were looking her over, we found that she had 2 seemingly superficial lacerations on the left side of her back end, as well as a much larger laceration on her right back end. We immediately anesthetized her in order to better examine the extent of her injuries, and during the examination, we found that the wounds on the left were actually connected to the wounds on the right under the skin. There appeared to be no damage to the surrounding muscles or lower tissue layers or anything like that, but some skin around the laceration was starting to bruise. So we proceeded by clipping and prepping her for surgery, and we then moved her into the surgical area. This is when Dr. Ann came in and began by trimming the edges of the wound to create a smoother, fresh edge to suture together. We sutured all 3 lacerations with a non-dissolvable suture material and placed a drain in the connecting lacerations. She was given 0.59 mLs of Convenia and kept for the remainder of the day to be observed. Upon examining her the following day, we found that she was very dull and also unable or unwilling to walk. Later on in that day, another tech began to observe what she thought was neurological issues. Because of this, we gave her 3 mLs of dexamethasone IV, and within that same hour, the patient began agonally breathing. So we removed her from the cage and began to assess what was going on with her. The patient began to vomit a bile-like substance, and it was determined that emergency procedures would not be successful if we had tried to do them to her. So she died right there on our treatment table of what we suspect to be internal damages, but the family did deny a necropsy, so the actual specific cause of her death is still unknown. In this second case study, we were presented with a chinchilla who was not eating and appeared to be bleeding from the mouth. The owner had recently rescued this chinchilla from an abuse case a few days prior. She claimed that the others that were rescued were adjusting normally, but this one was not. The patient was incredibly dull and very unresponsive at first sight. He was brought back to the treatment area for examination. This is when we discovered that he not only was emaciated, but also had a severe bumblefoot infection. Feeling him over, we also discovered that he had a broken rib, which had healed in the same position that it had broken. Despite all of these clinical issues, Dr. Collin, who was on the case, determined that we would still be able to nurse him back to health. That was until we took a look in his mouth, where we discovered that his top molars, which are pictured on the top left corner, had become very overgrown, rigid, and sharp, and they were cutting his mouth open, which is what was causing a lot of the bleeding from his mouth. When we looked closer in his mouth, we also found that his teeth were growing spurs on them, and these were tearing up his tongue and the cheeks and everything else in his mouth as well. With all of these ailments, it was not likely that he would fully recover. He was also just doing so poorly that we thought it would not be humane to put him through all the treatment that he would need, so the owners opted to euthanize him that day. This final case study was actually my favorite. These patients came in as another emergency case. The owner had called and said that both of her wired short-hair pointers had gotten into her prescription pills that were left in the car. They were rushed to the facility and immediately placed in a room. The male weighed approximately 55 pounds and the female weighed about 43 pounds. So under the orders of Dr. Hardisky, who's working on the case, we drew up 0.58 mLs for the female and 0.75 mLs for the male of apomorphine. They were given this intravenously in order to induce vomiting. When they began to vomit, we actually collected their vomit in separate clean buckets that we were later going to look through. We then took them back one at a time to the treatment area. The male was given 150 mLs of liquid activated charcoal and the female was given 215 mLs of the liquid activated charcoal. These were both administered by mouth. This was intended to help absorb any of the remaining pills that were left in their stomach before it could be taken into their bloodstream. After they both finished their activated charcoal, we then hooked them both up and gave each of them 500 milliliters of fluid subcutaneously to help flush out their systems. Because the owners were so quick to discover the dogs and bring them in, they were very proactive about it. The treatment that I just previously described was all that they required. They were actually able to go home that same day, and both of them made full recoveries. These are just a couple of other cases that I thought were very interesting that I was able to actually take part in and watch the procedures for. So on the left-hand side, we have an eye that we removed from a yellow lab that Cornell had sent back to us because they said the eye was just on fire and the issue was rapidly progressing. So we removed the eye at our facility. And then on the right-hand side was from another yellow lab that came in, just covered in open sores. This one on the bottom picture you can see was on her 5th digit. So the family opted to remove the toe, but they declined sending it off for biopsy. So we're assuming that the dog has cancer, but the family did not want to do any further testing to find out. So we just removed the toe and sent the dog on her way. She's doing perfectly fine as of right now. Another interesting case I was also able to work on, which is not pictured below, was a total ear ablation on a Cocker Spaniel that we had. He actually previously had had his other ear canal removed, and the infections had continued in the opposite side so severely that he ended up actually having both ear canals completely removed. So to wrap up the presentation, I'd like to say that overall I found this experience very beneficial. I feel like I've learned a lot, not only in the clinical sense, but also in a personal sense. I've learned a lot of the things that I am confident in, as well as a lot of the things that I'm not as well versed in, things that I need to work on and focus on to improve myself. Speaking generally about the clinic, I feel like it's very well run. The setup is very smooth and seamless. We get patients in very easily and we get them out very easily. We also have a very helpful and accepting staff. I feel like everybody that works there was always very willing to help me out and teach me new things and answer my questions, and I feel like they really took me in as one of their own. I also feel like the clinic as a whole runs very thoroughly. They get everything done that needs to be done and then some. They're also very good with their time management. I feel like no client really ever waits there for an exceptional amount of time, and the whole system and steps that they have in place just make everything run very smoothly. Overall, I have nothing negative to say about the clinic, and I really enjoyed working there for the past 3 weeks. The personal effects that this experience has had on me would be that it really has made me excited to continue my education and to become licensed and to start working and take part in everything that goes on within a veterinary clinic. I feel very self-fulfilled having completed this experience. I also feel very motivated to continue going and to get this done so that I can help people and help animals and be a part of something so great. This experience has also made me a lot more confident in myself. I feel like I not only have the school aspect of things, but I now have a more literal aspect of what it's like working in a veterinary clinic, and that makes me feel a lot more confident going into my 2nd year, knowing that I've learned a lot of the things that I'm going to just improve on as I go back to school. So again, overall, as I said previously, I have nothing negative to say about the experience. I feel very lucky to have worked in such a great clinic with such great people, and I'm very grateful for this experience and the opportunities that I was given while at this facility.